There was no objectivity attached to the quality of laboratory. Then in 1980, people started talking about turnaround time, quality control, accreditation visits, proficiency testing, and now in 2014, everybody who is running laboratory, most of the people, they know what is the meaning of quality control, what is proficiency testing, quality policy, standard operating procedures, and what is quality. From clinician's perspective, quality is right care to the right patients at right time. And in our laboratory, quality means right test performed by the right method on the right specimen, after right preparation, and right result is issued based on right reference data at the right time and at the right price and to the right person. Although all these things are written on the left side. And this quality is not optional anymore. This is a condition for survival. And in our laboratory, we have to look at all these things. They are the places where we may go wrong. These includes all steps, pre-examination, examination, as well as post-examination. And how we control all these things? We want to provide quality in our laboratory. We want to ensure accuracy of our report. But how? For this we require trained personnel, monitoring of our facility, temperature monitoring, humidity monitoring, etc., for sterility, and good calibrated and well maintained equipment, good quality reagents and consumables, and all these things only form body of our laboratory. And all of you will agree, body cannot function without soul. And what is the soul of laboratory? A uncompromised quality. And when we are doing all these things, we have to maintain certain documents, apex document of our laboratory, in which everything is written, how we will function our lab, quality manual, then standard operating procedure for different activities, to perform these activity in a consistent manner, different work instructions, and we have to keep the records of all these things. And it is very important, all these documents are prepared by some authorized person, these are approved by authorized person and released by some authorized person. Some person is keeping the record of all documents. This document is issued to person so and so, this document is issued to this ward, like we are issuing sample collection to all wards. Whenever we are revising our sample collection manual, old sample collection manual is collected from all the wards and new sample collection manual is issued. Therefore, distribution record is very important. And these are the various places from sample collection to release of report, which we are supposed to control in our laboratory. And doctors are ordering samples, then we are collecting samples, then we are transporting samples to the laboratory, and samples are tested and then analyzed, and results of our laboratory only as good as samples we receive or collect, garbage in and garbage out. And it is the responsibility of both laboratory professional as well as clinician to ensure the quality of laboratory. How clinicians are involved in our laboratory? If our hospital is located in some hospital, or even for a standalone laboratory, when we are catering to different physicians and surgeons, what is their requirement? We should develop test in our laboratory, the directory of our laboratory, or test which we are performing in our laboratory as per the requirement of clinician. If we have bone marrow transplantation facility in our organization, then what is the requirement of those clinicians? If we have very high and critical care unit, what is the requirement of those physicians? If we have liver transplantation, what is the requirement? Our testing facility should be as per the need of clinician. Then we have to generate test request form in consultation with the clinician. What is the requirement of this test request form? How we are reporting our cases, test report form. Then critical and alert values in consultation with the clinician. Alert values where monitoring is required, regular monitoring is required. Critical values where immediate therapeutic intervention is required. Potassium 3 is an alert value, but it is not critical. No immediate potassium transfusion is required, but 2.5 potassium may be critical. Immediate therapeutic intervention is required. Similarly, for platelet 70,000, regular monitoring is required, but for 10,000 platelet, immediate therapeutic intervention is required. These are difference between critical and alert values. And when we are defining critical and alert values in our laboratory, we have to include quantitative data as well as nominal and ordinal properties. What are nominal properties? Results which have more than one option, positive or negative. Falciparum positive, it is a critical result, or positive diphtheria, diplococci in throat swab. And ordinal properties which have some order but no definite quantitative relationship, like protein 2 plus is definitely more than 1 plus, but it is not double of 1 plus. Protein 3 plus is more than 2 plus, but it is not 1.5 times of 2 plus. There is some order but no definite quantitative relationship, and semi-quantitative and quantitative data where it is relevant. Then turnaround time for different tests, in how much time we will report our routine test, our urgent test. A arterial blood gas is of no value if it is reported after 4 hours. Immediate reporting is required. For neonatal bilirubin, immediate reporting is required, although not as urgently as in case of ABG, but at least within 2 hours. Then we have to define in consultation with the clinician, we will report this case, this test in this much time, this test in this much time, and if we find any delay because of any reason, it is our duty to communicate to the clinician. Biological reference interval and advisory services. Advisory services is also important. Sometimes clinicians want to discuss how frequently this test should be repeated, what are the other tests which can be done in a particular clinical situation. Then it is the duty of the laboratory professional to discuss these cases with them. And how we can make our personnel useful to our organization by regular training and their evaluation, competence evaluation, their performance evaluation, and opportunity for upgradation of knowledge and skill. Training evaluation is, suppose we are performing training for pre-examination activity for phlebotomy room, then whether that technician knows after training how a sample of CBC should be collected, how a sample of PT and PTTK should be collected, and this is training evaluation. And competence evaluation is whether he is able to apply that knowledge in a proper manner or not. That is competence evaluation. A person may be trained and competent, a person is very good, but he is not ready to work. Whenever he is not supervised, he is leaving the lab early, or he is busy on mobile or something else. He may be trained and competent, but his performance is not good. And regular opportunity for upgradation of knowledge and skill. And we have to control all these activities: pre-examination, examination, post-examination, storage of sample in our laboratory. We have to keep vigilant eye on every step in our laboratory, regular training, then monitoring of our lab for temperature, humidity, for sterility, for fire safety, storage of hazardous material, biomedical waste, lab equipments, calibration of our lab equipment, validation and verification of lab equipment, checking of reagent whether they are meeting acceptability criteria or not. What is calibration? Our instruments. What are our instruments? They have optical system and a software. With optical system, what is the basic biochemistry? We are dividing OD of test by OD of standard into concentration of standard. And when we are multiplying this OD of standard into concentration of standard, this instrument calculates one factor, which is then multiplied by OD of each test, and value is generated. And when we pass a sample of known concentration calibrator through the analyzer, they generate certain OD value. What we are doing, 100 milligram glucose means this much OD, 0.348 OD. Then our all results are based on the accuracy of our calibrator. Therefore, it is very important the value assigned to a calibrate is accurate. And how we can ensure this accuracy? These calibrators, the value is assigned to this calibrator based on value of some higher calibrator, and value of those calibrator is based on calibrator of certain further higher order. This is called traceability of the calibrators. These calibrators must have traceability. Traceability is, with this traceability, these results are comparable with the national or international standard with unbroken chain of comparison, each having stated uncertainty. Stated uncertainty means कि if we test a sample 10 times or 20 times, it will not give you exactly the same value. There may be minor difference. It may be 64, 63.8, 63.6, 64.5, but this uncertainty should be within the acceptable limit. And what is validation? Validation is we are assigning certain property to something. Like suppose you want to develop some software in your laboratory. First you will decide what exactly you are expecting from the software. You want name, age, sex, name of the test, method of the test, result of the test, units, biological reference interval, some interpretation should be there on the test report. Then you are telling your requirement to the software provider. He will develop software for you, and based on your requirement, then he will check the software, whether that software is meeting your requirements or not. And when he will ensure himself this software is meeting your requirement, then he will deliver software to you. This is validation on his part. Then you would like to ensure yourself before starting that software for patient results whether his claims are correct or not. Then you will generate some dummy reports whether all information as per requirement are there or not. What you are doing? You are verifying claims of the vendor. This is called verification. And the more simpler example is, all of you know the story of Shabri and Ramchandra ji.